So, there's a little primer on the politicization of science. Let's talk about Insite. Let me first acknowledge that I'm up here talking about this evaluation and a huge body of work. And in fact, I'm a member of a large team who has produced this work. In particular, I'd like to especially acknowledge my colleague Evan Wood, who has worked tirelessly on this evaluation, but also our director, Julio Montana, and my colleagues Mark Tyndall and Will Small, who you're lucky to have Will here today to speak as well. It comes as no surprise to anyone here that Vancouver was the site of what's been described as the most explosive HIV epidemic ever observed in the developed world, with an annual incidence of 18% in 1996-97, and this occurred among the injection drug using community in the downtown east side. At that same time, British Columbia was experiencing about an overdose a day, and this was also at epidemic proportions, leading the Vancouver Regional Health Authority at the time to declare a public health emergency. The city has also been the site of what is widely known as probably one of the world's largest and most visible open drug scenes, resulting in all kinds of public disorder and social harm. That led to this place. This is Insite, and it is located in a 100 block of Hastings in the heart of the open drug scene. Its entrance is virtually unnoticeable from the surrounding areas, except that I would argue it's one of the nicer looking facades in the area. After people come in and register, they are eventually led in through a controlled door to this room, the injecting room, where there are 12 booths for injecting. The site is open 18 hours a day. They now supervise an average of 800 injections. Their injections are supervised by a nurse and other support workers who provide a range of supports from safer injecting education to counseling and referrals. And there's also an addiction counselor who works in another area, which we'll talk more about, who provides a great number of referrals to external services. So our group was asked to evaluate the scientific evaluation, and although some of the critics of our evaluation have claimed that we're a very pro-safe injection site, the fact is when the initial RFP came out to do this evaluation, we didn't even apply. We were concerned that this would be a very politically charged evaluation, and we had a lot on our plates already, and we thought we would leave it to others. But unfortunately, no suitable candidates came forward, and it looked like the site was not going to open unless a credible group came forward and took on the evaluation. And so, with some urging from our community partners, we agreed to do it. However, recognizing that this would be a very charged evaluation, as a team, we decided that we would take all measures to ensure the highest level of scientific integrity and transparency. We did a couple things. We assembled a provincial steering committee consisting of all major stakeholders, including the RCMP, the Vancouver Police Department. It was chaired by the provincial medical health officer, and we ensured that they were aware of all the methodologies and all the evaluation results, and we sought to make sure that we were translating our research into understandable language. We also did a very unusual thing. We could have just simply waited till the end of the 3 years of the evaluation and produced a massive report. But we all know what currency reports carry. At the end of the day, anyone can dismiss a report, say it's biased, and it gets just put on the library shelf. So we instead fought for and won the right to pursue independent scientific review of all our studies prior to publication. We said that we will not publicly share the results of any work until it has passed the test of independent scientific peer review. And let's just consider what that means for a second. I'm sure a lot of you are aware, but I'm always reminded that as a scientist, I say things like peer review and nobody knows what I'm talking about. So let's just make sure we're clear. What we do is we decide we're going to conduct a certain study, like an evaluation of the impact on syringe sharing. We go through the analysis, our statistician pulls the data, we write up the paper. We then submit it to a journal. The journal editors look at it, they decide whether it's worthy of peer review. Then it gets sent out to an anonymous group of experts in our field. So they pick the top international experts in our field, they review our paper. They submit their reviews to the journal looks at those reviews, then they pass them off to a statistical editor. The statistical editor for the journal will use the numbers in our paper, make sure everything's right, and then they decide whether our paper is worthy of an opportunity to resubmit after revisions are made. And so at that point, we get the reviews back, we revise our papers, we consider all the comments, we submit it and hope for the best. The editors look at those revisions and they decide whether it's worthy of publication in their journal. We get accepted or we get rejected. We also took the step of adhering to the training criteria for the transparent reporting of non-randomized designs. And what we did was we actually published our evaluation methodology in an open access journal. This is available online, and it gives full details of the evaluation approach. Again, trying to maximize transparency. But before the evaluation had even produced any results, the politics had already started. And unfortunately, we had very early on a visit from the U.S. drug czar, who declared before any results were available that Insite was nothing other than state-sponsored suicide. Our evaluation is focused on 3 lines of inquiry: description of processes and operations. We've also sought to determine evidence of positive health and community benefits. And because many people were concerned that Insite would somehow lead to adverse consequences such as enabling drug use or people taking more risks, we sought to evaluate whether it was having any adverse health and community impacts. So let's talk about some of the findings. There are now over 25 published studies, about another 5 or 6 that are under review. I simply don't have time to address them all, so I'm going to give you some highlights. One of the first important papers was a paper in the American Journal of Preventive Medicine. Whenever you start an innovative initiative, health service, you got to make sure it's attracting the right people. If you set up a service like Insite and healthy people come and all the high-risk people don't, you can't expect much impact. So we looked at who were the people who initiated use of Insite. Well, before Insite opened, they were people who were highly likely to inject in public. There were homeless people. There are people who injected heroin and cocaine on a daily basis or more often. And also there were people who had recently reported having a non-fatal overdose. And we concluded that therefore the site was attracting people who were at high risk for HIV infection and overdose, and also people who were responsible for a considerable amount of public disorder in the community. And it was attracting the right people. We followed that up with a paper in the American Journal of Public Health, which showed that Insite had succeeded in actually retaining that population, that they kept coming back and using the site on a frequent basis. A key interest also was in the site was whether it was having any impact on public order. There were those who thought that taking 800 people who might otherwise inject in public spaces off the streets and indoors might improve public order. Other people said that it will attract people and make public order worse. So we published this paper very early on in the American Journal of Preventive Medicine. What you're looking at in the top panel is an 18-week period. The dotted line represents the opening of the injection site. As you can see, from week 7 to 18, the number of injection drug users, that's what IDU stands for up there, using the site gradually increases and stables off for the first 18 weeks. First 12 weeks ago, 500 visits per day. In the bottom panel, you see the number of people who were injecting in public in the 10-block area around Insite. And as you can see, as use of the site increases, the number of people injecting in public goes down. You see the same effect for publicly discarded syringes and other forms of injection-related litter. For the people who are interested in statistics, we actually used each of these measures of public disorders as a dependent variable in some multiple regression models. We were concerned that people might say, well, there was more police on the ground at the time, and you know, that might have helped. So we put police presence into our regression models. We also thought, well, it's Vancouver and if the weather's bad, it's September. Maybe if it rains more, less people will inject outdoors and people might attribute the reduction to weather. So we got the National Rainfall Statistics and we entered that into our regression model. And guess what? The use of Insite had an independent effect on reductions of every measure of public disorder after adjusting for the effects of policing and rainfall.